Hello. I know a lot of you, and I'm so very thankful to know you. My name is Julie Hirschberg. I am a neurologic physical therapist, and I have this man right here to thank for introducing me to June and connecting me with the FSH Society. I'm here with a colleague of mine, Allie Southam, in the back. We're actually going to lead a little breakout session when we're done at the end of the day here. And she's been a collaborator of mine. She's met a few of you because we hold free physical therapy screening days for people with FSH at our clinic in the spring. And so I know Allie actually did a bunch of those just last spring, so she met quite a few of you. Just a little bit about me. I teach in the physical therapy department at USC, and I get to teach hundreds of physical therapists a year about FSHD. Actually, Brian is in my slides, so if anybody wants to help teach, you can join the slides with Brian. But I find that a privilege, and I think it's really important. As you all know, and you've been out and visited doctors and therapists before, just having some knowledge is so powerful. And then I also run an outpatient neurologic physical therapy practice not too far from here by LAX. And I love the FSH Society. So this is probably my favorite organization to work with. Every single person I have met in this organization has taught me so much and is such a support to one another. What we're going to do today, just briefly, and I feel silly having slides because they're like in plain English, and I was taking notes like mad when he was talking. It was so fascinating. I'm going to review the research findings in relation to exercise in FSHD, and my hope is, gosh, maybe in 5 years we won't even need to talk about that because you won't need it. And you won't need to find as special ways to exercise because there's a cure. So I want to start here because I think probably most of you know, because you are even more informed than I am, that there are very few clinical research trials in exercise in FSHD. So we really, when we as physical therapists look to bringing the best for you all, we have to look at what evidence we do have, what are some expert guidance for people who have worked in this field, and I think most importantly, what you bring to the table. What do you actually like to do? You hate riding a bike, and so all of these lovely research trials that are all on a bike would not make any sense to you. Or you love hiking and walking outside every day, and that's going to be really important. So that's something that I think a physical therapist, this is their expertise, is bringing in what we know about the disease, about exercise, about movement, and really combining that with what the person brings to the table. And then I think that's the sweet spot, is finding those all together. So I'm going to try to briefly go through 4 studies that are all within the last 5 years, and these get me super excited. So this first one just came out this year, and did anybody see this one? Read about it, the high intensity training? No. Okay. Well, then it's new and exciting. So what's very interesting, I almost put a globe up here, but all of these research trials are not in North America, not even near us. So this one is based in Denmark, France, the Netherlands. There's some huge research centers there where they're studying this in exercise. So this is the first one where they were looking at something high intensity. So how many of you were maybe told at some point that exercise might be detrimental to you? Yeah, so quite a few of you. And so this is the first one looking at high intensity, and this is after a long slew of studies just to show that exercise was safe, that it didn't break down muscle tissue. So in this study, what I love about this studies is they buy everybody a bike, and they get to take the bike home and use it at home. And so here they had a stationary bike, and they also did it in a clinic so that they could could get some feedback. They did 8 weeks, 3 times a week, and it was only 21 minutes. And I was kind of excited about that because I was like, ooh, sometimes that's all I've got in my day. I wonder if I could squeeze in 21 minutes. And this graph over here shows you what they did, and I'll explain it a little bit here. So essentially, this is one person's heart rate monitor for a session, and you can see this is their maximum intensity and then the lower intensities, and these colors correspond. So for each interval, they would do 30 seconds at a low intensity, 20 seconds moderate, and 10 seconds at a high intensity. And then they would just repeat that. So they would do a little warm up, do these little intervals where they would go really, really, really fast, get the heart rate up, then rest a little bit, and then do another interval. To me, who I'm not a cycling person, that just sounded more interesting than just cycling at the same rate over and over again. And what did they find? So first, they're always looking first that they didn't do any harm, so no muscle damage. People had improved fitness, which is what they were looking for because they were specifically doing aerobic exercise. And then maybe not that interesting, though I always want a happy ending for everything, is really didn't find any changes in functional measures. So this is a 5-time sit-to-stand test, a 6-minute walk test, muscle strength, very common measures that we would use all of the time. No change in that, but when you're on a bike, you're not really working on those things. So they improved what they worked on. They worked on aerobic, and they improved somebody's aerobic capacity. And they didn't cause any harm. So this particular study gets me really, really excited because of some of the outcomes here. So in this study, this was in France, they wanted to do both aerobic training but get some strengthening in as well. And they did it on the bike. So once again, actually all 4 of these studies are on a bike. And like not a comfy bike, but like a super uncomfortable bike. I'll even show you a picture. I've been on the bike. It's not very comfy. One of the studies actually had a very low adherence rate, high dropout rate because of pain. And I thought, well, yeah, that bike, it's uncomfortable. So anybody would be in pain. So in this one, let me pull up the graph here. So this was the name of the trial. And here's what they did. So they did some combinations, 2 sessions that were aerobic and 1 session that did an interval. And in their aerobic, they did a warm-up, they did a higher intensity, and again, they're looking at heart rates. And then they did near maximal pedaling cycles. So like ramping up that, the resistance on the bike to where it's almost at a maximal level and doing 5 sets of 10 repetitions. Like this is hard stuff, right? So that was part of their strengthening. So they combined the aerobic and strengthening. And then on the other day, they did interval training. So they do a warm up and then they do little intervals of more high intensity, again, aimed at that heart rate increasing. And what I also really like about this one, it was progressive. So over the time, it was longer, it was 24 weeks. Over that time, they got measured and they assessed how well they were doing, and then they progressed it, they made it harder. So that's a very important piece, I think, as a physical therapist. I never do something over and over and over and over again. You want to keep it progressing. So they did that, and they used telephone support and in-person support to keep people going, and that turns out to be very, very important. People drop out of things when nobody's checking in on them, right? And I mean, who else likes a little coaching when they exercise? Like, I like somebody cheering me on, right? So very important. So what did people have in this study? Less fatigue, improved VO2 max, which is just a measure of aerobic capacity. This is the kicker. I was super excited about this. Increased quadriceps muscle strength, endurance, and they had improved increased muscle fiber cross-section area in the quadriceps. So first of all, thank you to all the people who were in this study and wanted muscle biopsies several times, right? Like, no thank you for me. But they showed that people with FSH could improve their muscle fibers in their quadriceps. People loved it. They did it at home at a very high rate. Here's another thing I would like to see a little bit better. There was no change in quality of life. If I'm going to commit 3 times a week for 24 weeks, like, oh my gosh, it should change my quality of life. So I think there's some things that can probably be improved on when we look at exercise and helping it to carry over into daily life. Okay, this one also out of Denmark. This one, oh my gosh, thank you, Jeff, for asking the question about protein supplementation just last week to me. And I had to go, I feel like there's something out there. And sure enough, there's an exercise study looking at the addition of protein supplementation. This is something I get asked a lot. Bottom line is that it didn't change things. It didn't hurt things either. But these people also, again, trained on a bike, trained aerobically. They were only monitored by phone to check in, and they did a protein supplementation and compared it to a placebo, and basically the supplementation or the placebo were the same. So this is out of a group who does a lot of work in protein supplementation and muscular dystrophies, and they've had other studies that have showed benefit. And just not particularly in this study, but this was the study where they had a high number of dropouts and a lot less adherence. And they therefore also didn't have as strong of results. One thing, however, for this one, and they started talking about how maybe even the placebo helped here, is that people did have improved physical activity and the quality of their physical activity in this study. A lot of building evidence here for aerobic exercise being able to improve people's fitness and overall health. And I like the way they showed this graph here, but basically they asked people questions about where they saw their walking function, muscle strength, endurance, physical activity, and fatigue, kind of pre and post, and these were the protein in training, placebo in training, and the control. And you can see with the percentage of people who felt like it improved was much higher in these two groups compared to the control. They got a fake protein powder, and they did a study actually to show that no one noticed. No one could tell the placebo versus the protein powder. Now, I feel like I'd be able to tell, having taken quite a few protein powders before, but according to them, they couldn't tell. Okay, so lastly, this was one that I talked about last time a few years ago. This was like the latest study, and since then, there's been a lot more, which is very exciting. There's that bike. Like, who wants to ride that for 24 weeks? Okay, it's like the gold standard of bikes out of Sweden. Every research study I've done with a bike has that bike. It's very reliable. But anyway, I don't want to ride it. So in this exercise study is fascinating. So they compared aerobic exercise with cognitive behavioral therapy. And these people did 3 times a week for 16 weeks, or they maybe did 3 sessions of cognitive behavioral therapy. And guess what? They were the same outcomes. So both groups had less fatigue than control, improved physical activity, no change in strength or aerobic capacity, but these changes lasted beyond the study. So they did a long study. They also did a follow-up where they looked at MRI and fatty infiltration of the muscles, and they found that both of these interventions decreased the rate of fatty infiltration in the muscles. So cognitive behavioral therapy, not exercise, just as beneficial. But what happens when you start to change your beliefs about how you can move is that you increase your physical activity, and that therefore start to actually change the muscle. So I find that very, very strong, and a very strong reason to have a very personalized, individualized exercise routine that uses principles that we gain from from our psychology counterparts. So, bottom line, exercise is very safe. It's not going to break down muscle, and it's beneficial. So you can improve aerobic capacity, you can improve strength, at least in the quads. I think we need to look at a few other muscle groups, right? That's not the only one, and it's actually one of the strongest ones, sometimes in FSH. At home, being at home is really important, being accessible. Having the coaching, progression, and feedback are key ingredients. And considering the type of exercise and pain. And this is where I think we really get to some FSH specific recommendations. Now, there is no randomized controlled study in aquatics, for example. But who here likes to exercise in the water? Oh my goodness, why don't we have a study? So I love exercising the water, but for people with FSHD, this is almost across the board. There's some people that just don't like water. You can exercise, you can get your heart rate up, you can exercise very weak muscle groups all in the water. So I think that's probably one of the #1 recommendations that I see people make. For aerobic exercise, so I'm not sure why these exercise studies didn't have something like a recumbent bike. Much more comfortable, has back support. They didn't consult me. The recumbent bike is kind of the gold standard in the exercise physiology world, but I think in the PT world, in the comfort while you're exercising world, it would be the recumbent bike. So that's something I highly recommend. And then supported treadmill training. Has anybody done this before? Like with a harness support or in the Alter G? So the Alter G is something you zip into and it blows up with air. It's really quite comfy. It feels like you're walking on clouds. But you can push yourself harder because you can't fall. You could take up some of your weight so your legs move easier. So all of those are things that a clinical expertise would bring. And then strengthening, this I think is quite individualized. Some people just in their daily life are overusing muscles. So it's very, very specific to find particular positions to go through. So maybe your standard gym equipment or machines don't work because you can't take your arms or legs through that range of motion. So this is quite individualized. And especially if you can't move against gravity, then you have to have other positions to get into to strengthen. And then finally, flexibility. And this is something that personal experience of if you overstretch a muscle, especially a very weak muscle that did feel very tight, it can lead to instability. So this is very individualized, that you find that fine balance of stretching the right muscle, the right amount, so that you don't end up unstable because of weakness. This is probably one of the areas I get the most questions about is equipment. And there's that wonderful, there you are. We were talking at our table at lunch and how frustrating it is to find equipment that doesn't look hideous, that does the job. And I feel that frustration as well. So this is where I think finding a neurologic physical therapist who knows the system, knows the vendors, knows the rules for insurance, what's covered, what's not, can help you navigate that system. We were talking at the table too, like 6-month process to get like a lift for your car, right, for the scooter. And I was just like crying inside. That's so frustrating. And so I think finding a therapist as an advocate for you to navigate that system would just would alleviate some of that burden. So finding things like abdominal supports that don't have horrible metal parts that tear up your skin, right? Finding the oodles of kinds of braces for foot drop that are super lightweight and they withstand a lot of heavy use. Mobile arm support. So this is something that, that we've tried for a few people because they're just like, shoot, I want to just be able to eat without supporting my elbow on my leg anymore. Or it's required for work. And so that's something that we've set up for people. And again, it's quite individualized, but I think really having a therapist, an OT, a PT on your side to help navigate that can be so helpful. And I think from, you know, what you all bring to the table and where we come together kind of as a team is preventing a downward spiral, especially from disuse. So I talk to people a lot, they're like, well, can I strengthen? And there's probably some things that you just stopped using because you're not doing something anymore, and it might not be from the disease itself. Those things you can strengthen hard. And so I think it takes an in-tune therapist to help you find those things, and then you're on your way. Anybody else use like an Apple Watch or activity tracker type of thing? So I'm kind of addicted to my Apple Watch, but I love having my heart rate right there. And when we talk about aerobic exercise, it's so important to be able to follow your heart rate and train to your heart rate. But I think looking at overall activity level in general is really nice with those fitness tracking apps. And the last piece here is that what you all have taught me so much is how in tune you are with your body, and that you're listening to it so that you don't overdo things, because this is where prevention of falls comes in. So not overdoing it to the point to where you are falling because of fatigue or muscle weakness. And I think that's another key area that, especially if you're newly diagnosed, a therapist can really help you find that kind of just right level of activity for you. All right, I'm going to leave it there because I know Allie and I are going to be here in the afternoon to kind of be really specific and answer a lot of questions. But what I highly recommend, if you want to get started in exercise, and especially if you're like, okay, I can try the uncomfortable bike and I'm up for aerobic exercise, is to talk to your physician, neurologist, physiatrist, or a PT or OT. And actually, we have it on our handout, I think, Allie, of a great website where you can find a neurologic physical therapist in your area. And actually, I do this all the time, is I've met many of you and you've come a long way to see me, and I say, okay, now go see somebody here. And this is who I know here, and they're great. And so just ask me and I'll find a person for you. And I thank you guys so much for inviting me, June, to be here. And then I've just learned so much from you. And I feel like I can use that to continue to help other people who are in your shoes. So thank you.
Julie, after the mention of yoga, Pilates, gyrotonics.
So how come no mention of yoga, Pilates, gyrotonics? Because I had like 25 minutes. So I love yoga for people with FSHD. I love Pilates. I was talking to Corey, it's like my #1 recommended activity because of the focus on the core. I love Pilates for myself. I love yoga as well. Gyrotonics, the same. So I think all 3 of those, in fact, there are many spin class. I mean, there's many modalities of fitness that would be appropriate and wonderful for people with FSHD.
But would you put that group of exercise at the top above this other stuff, or would you put it underneath?
So where would I put this kind of in the hierarchy of things? So I would put it in the place where you put it. That's what I would say. The research evidence is not there for any of those things, but that's true for most diagnoses. Yoga is being explored a whole lot more in other populations, and there's evidence there. So when we look at kind of those circles, right, and where that sweet spot is in the middle, it's looking at research evidence. It's looking at what you prefer and you like to do, and it's looking at what our experts tell us. Now, I know from experience of working with people with FSHD that Pilates and yoga have been very helpful. So I would kind of put that in that clinical expertise. A lot of people have found that really helpful. The principles of it are very, very in line with what we know about FSHD. So, you know, I think if somebody's been doing yoga and wants to keep doing it, it's like, let's find a way that you keep doing yoga for the rest of your life in a safe way so you don't get hurt. And that's what you need, you know, and that's what works for you. And you can even get your heart rate up in yoga, right? So I might say, well, let's look at what your heart rate looks like in yoga, or let's add aerobic exercise because we know it's beneficial. Yeah.
Okay. Is there a point, for example, in all of the biking that's recommended, where rather than building up muscle and strengthening muscle, without knowing it, you're breaking down muscle?
So that is definitely what they thought would happen, is that, you know, instead of building muscle, you're breaking it down. They have found no evidence of that happening. And they've used biopsy, they use the creatine kinase lab work immediately after exercise and found no muscle breakdown with these exercise. Now, remember, any study in FSHD is not a huge study. You know, these aren't thousands of people. These are small groups. Most of them, all of them actually are people that are walking. But the only thing that they say is that they have to be able to cycle. They're not saying how strong they are, how involved their FSHD is, but they are walking and they have to be able to do the cycling. So we can't answer that question for somebody who's not walking or not able to cycle. Yeah.
But even for somebody who is walking, as a former as someone who early in my life I was a long distance cyclist. And so there's a difference between doing the study on a recumbent bike where you're riding a bike for 30 minutes versus riding 75 miles and going uphill. Right, so I think, you know, the study may not show it given the amount of exercise and the intensity that they were doing, but I think if they did another study that kind of pushed these people a little further, the results could be different.
Yeah, I think that's a really good point, thinking that if it was longer, you know, 75 miles and uphill, like, whoo, like my muscles are breaking down. So yeah, I think you're right. Look at the amount they were cycling, 35 minutes. You know, it's a pretty controlled amount. But I would say there are definitely stories of people who walk long distances, who ride recumbent bikes for long distances with FSHD and do very well. Like, they're in this room. Yeah. So I think it's quite individual. That's the hard part, you know, and that's where I think it takes a really trained person to make sure that you really aren't hurting or harming. But I think we don't know if we push it a little bit.
Oh yeah, I just have a question regarding what you were just talking about in terms of it not breaking down. Isn't that how muscles actually build? And then so, another real quick question is creatine supplementation, has that ever been looked at in that study, or?
Yes. So yeah, so two questions. I remember the second one. So it was about the creatine and creatine supplementation, and has that been studied? I couldn't find it in exercise, but from the physicians back then, I'm pretty sure there are studies. You're saying so, Mike, right? Okay. So the physician in the house is, you know, it has been studied, and I think we've had this conversation, I think. Studied but not shown. It doesn't hurt, but not helpful. And the second was, when you actually work a muscle really hard to strengthen it, you break it down? Yes. So exactly. So you were precisely right. When you are strengthening to the level to build change in the muscle, you are actually breaking the muscle down to build strength. And what the one study showed, that high intensity, high resistance exercise, which would be the amount to really kind of drive strength changes, caused those strength changes to occur and increase cross-sectional fiber area of the muscle. So evidence that that did occur. Ellen.
So, you know, for somebody who maybe isn't walking, and exercise is a little bit more difficult, I liked what they did with the sort of, you know, the small reps kind of thing. How do you actually physically do that? I mean, do they have a bike that does that for you? Like, okay, for 5 seconds you're going, you know, how do you handle that?
Yeah, so that's a great question, and I think this is a huge area that's kind of missing in the research as well. So the question was, first, for somebody who is not walking and not as physically active, exercise is a lot harder. It's harder to get the heart rate up. And so the first kind of the question is, how do you do that? And how might you do, I really like that interval as well, because I was like, oh yeah, 30 seconds, I could do that, and 20 seconds, and 10 seconds, yeah, I could do that. So how do I do that as far as in therapy? That's via heart rate. So that's looking at, okay, you're going, faster, harder to get like that 10 seconds at that really high heart rate. And then, you know, I'm just watching the clock.
But if you're, let's say you've got a pedal bike of some sort, right? And I guess you have to have it on a very low setting or a high setting, something, so that it's easy to push.
Yes.
Is that what you're talking about?
Yes.
So you would go slower and
then yeah, so if you have like a pedal bike that you can roll up to and start pedaling, would you kind of start slower and easier and work faster and harder? So yeah, so you have two variables that you can manipulate. You can manipulate the resistance on it, and you can manipulate the speed at how fast you go. And you can play around. So I play around with those with my patients to see what gets the most bang for your buck as far as heart rate goes. So if you're looking for aerobic changes and you like, this is, to me, this is like for that person that I like to get my heart rate up, I like to sweat, I want that feeling, then let's find the best in between. And it may be, depending on your patterns of weakness, it may be that you're able to go faster but not against more resistance. You know, and that's quite individual. But
I mean, the connection also that you made between the cognitive and the physical therapy, it sounds like it's really a win-win for many people.
yeah, the connection between the cognitive and the physical therapy, absolutely huge. So I think physical therapy back in the day was like, here are your exercises. It's a generic sheet, and I give it to everybody, and you're gonna do 3 sets of 10, and these major muscle groups, and that's what you're gonna do, and I'll like, yeah, oh, good job, like that's great. So that's not physical therapy today, and if it is, come talk to me, we'll find you a therapist. It's about understanding exactly what you need as a person, setting goals. So we use a lot of techniques of motivational interviewing, a lot that comes out of the psychology world, so that it's not just like a one and done, okay, here's your exercises, great, you're better. It's like, how can I help you exercise for a lifetime and stay healthy and well?
Right.
Yeah.
Yeah, so it becomes part of your daily pattern of whatever you do.
Right, so it becomes part of your daily pattern, which I think misses out on some of these trials because you see quality of life didn't really change. Well, you exercised on a bike and you were part of a research study, but it didn't really translate to your life. Yeah, and lifetime habits.
Julie, whilst you were looking at those research studies, did you see what happens, you know, when people were exercising? Obviously, over a period of time, their strength will increase. I've seen it myself. Was there any indication that there was like a genetic brick wall that you would hit, like a limitation as to how much strength a person would gain before exercise, continued exercise they wouldn't be able to increase any more strength over a period of time? I think that's what I'm trying to say.
Yeah. That is such a great question. So within those studies, was there like a plateau and somebody just couldn't get further, right? And the longest study so far was 24 weeks. And in that study, they actually looked at them every 6 weeks and people kept getting better. But, you know, it was a grant. They only had 24 weeks. That's all they looked at. So I think that's an excellent question. And when we're talking about lifelong health, like, maybe we should study it for longer, right?
Well, and Julie, I think they're also looking at people that are walking.
Right.
And so their quality of life is going to feel maybe much more connected. They still have some of that muscle mass. I think that for people who aren't ambulatory as easy anymore, that's what, you know, a lot of our heads are trying to wrap around. Mm-hmm. You know, what do you do not just to sustain that, but what do you do to increase that?
Right. So when you're not ambulatory, what do you do to not just sustain where you are, but to increase that strength when it's kind of at a certain level? And that's where I think it takes a whole lot of creativity. You know, you can't just throw somebody on a bike, and they can't do Pilates, and they can't do yoga traditionally, right? And it's where I've found much more success in the pool, because you can indeed get your heart rate up when you're supported and moving what you've got.
Like exercise and like a bike in water or something like that?
Oh, bike in water, treadmill in water, just plain exercise in water. I think there's a lot of great resources when it comes to water.
Thank you. You appropriately qualified these studies as saying there were limitations to them. My concern with them is the constantly searching for improved strength. I think that very much depends on where you are in the progression of the disease. Our disease starts really from the top down, and the last area to go is the quads. So they're the easiest area to build strength on for some of us may be different. So I find that I'm a little disturbed by that constant quest for strength. I'm all for physical activity. It's important for the vascular, the cardiovascular, all the other muscles that are not quite as affected, range of motion, life, very important, but to qualify it only by looking at increased strength. I have seen a lot of patients in all good intention become injured by their physical therapists who are looking for that quest only rather than just maintenance and that, quote, quality of life.
Mm-hmm. Yeah. That was really quite beautiful. Thank you. I wholeheartedly agree. And that was like I was excited to see a change, but it was definitely with the note of like, but the quads are usually pretty strong for people. So it's with a grain of salt, right? And I think when, you know, if somebody is coming to therapy, or if your primary goal is like, I want this one muscle to be stronger, I think that you're usually set up for failure. So yes, can we make something stronger? Can we set you up in a movement better to use the strength that you have? Can we change muscles that have just not been used? Maybe they're not weakened by the disease itself, but you just stopped using them. Can we activate some things? And actually, I didn't put these in here either, but you can actually even put neuromuscular electrical stimulation on a muscle and improve some of its activation. And activation is a little different than a pure strength gain. So I agree. I have luckily not seen a lot of people injured by physical therapy, but it definitely happens. And I think having a really good dialogue with your therapist and educating them, because you know your body so well, I think that's very important. Yeah.
Well, thanks. I just wanted to share, I'm lucky enough that, sorry. I share with Amy the frustration of it. I'm lucky enough to be quite active, and I think it's really interesting to see, I know why we're measuring and all of that. It's going back to, I guess, diagnosing the disease and progression. But I think at the end of the day, again, I've been lucky enough. I've been exercising for 20 years. I'm very frustrated. I don't do yoga. I've tried it a million times. I come out in such a bad mood. Because the teachers know nothing. I've been to physical therapists many times, and I come out swearing and frustrated because, not yourself, but there's very few trained physical therapists, and we tend to all get thrown into a group with the people recovering from a knee or a hip, and people do not understand anything about what we're doing, and we kind of get a little tired of having to educate all the doctors and all the physical therapists about our disease. Summary is, I've been working out for a long time. Electric bikes are great. You can get an electric bike, you can get a tricycle, so that you never have to worry about getting on and off if you can at least use your legs. Swimming is amazing. You can, if you're in a wheelchair, my friend at the pool is in a wheelchair. There's the chair that puts you in the water. Once you're in the water, the great thing about it psychologically is you actually feel normal for a little while. You're not having this resistance about trying to grab a leg and bring it up and try to walk. It's a real high to actually get in the pool and do it because you feel really great. And I'm lucky enough to be able to walk with AFOs. But it is a little, I'm just trying to share, I'm sorry I don't want to bring it all down to the thing, but I share with Amy, but I think swimming and getting in the pool is really a great thing, especially for people who can't walk. So that's just my little 2 cents. Thank you.
I had to say something.
Here.
This is just adding to whatever you said. I heard about underwater treadmills. You guys have.
I can't hear you. Underwater treadmill.
Can you hear me?
Yeah.
Heard a lot seen about underwater treadmills. So where do we have this here in Southern California?
Cal State Northridge.
Valley College. Valley College.
Yeah, see, you guys know a lot.
Yeah.
Thank you.